This is my third attempt at this. For some reason it stops working. So Ian's on Capiri, which is capecitabine and Irinotecan infusion, and his is capecitabine, who knows, tablets. So he has 2 different sizes to make up his correct dose. So he takes 3 of the big ones, which are 500, and 2 of the small ones, which I think are 150 milligram. And you also get sent home with a Dancitron, which is an anti-nausea med. And then you also get your steroids, which will keep you up for 2 nights post-infusion. Here's me struggling to get them out of the bag. Oh, I also didn't fully cover his name. So that's the dexamethasone, the steroids. And then this is where I store his capecitabine. You have to be very careful to store this. You cannot touch it. You shouldn't really store it in anything other than its original packaging. I put it in here. This stays out of direct sunlight, out of the heat. This makes our life easier. I do so very carefully. It's very satisfying to click as well. And these are the extra goodies we got sent home with. Obviously, you've got your cancer treatment record, goes everywhere with you, your sepsis risk, so if you go to hospital. This is your traffic light symptoms, keep an eye on those. Fills in, you'll also have what you're on. This was used when Ian was on K-Pox. All the meds and what to do with them. Very, very handy for your caregivers. And here's the extra goodies. So loperamide is an anti-diarrhea med off the top of my head, which is important on Irinotecan, I think. We may find out soon. Dulcoes, obviously, stool softener, says on the tin. Laxidone is a laxative, also the name is in the clue. Not the most pleasant stuff. Cyclazine, I think, is anti-nausea. Yes. And then capecitabine can cause ulcers, so you get some mouthwash, which he actually didn't get last time round. So we're pleased with that because he did struggle a little bit with his mouth. You also might get hand and foot syndrome, so your creams are very important. E45, and then the Mac Daddy of creams, the Udderly Smooth. This stuff is incredible. So when I'm obviously looking after Ian's hand and feet, this makes mine as smooth as a baby's bum. Incredible stuff. So we're very, very lucky that they gave us another tub of this, because I'm obsessed with it. And then Ian's going to have a port put in a couple of weeks, so he needs to use this body wash beforehand. I think it's something like 3 days beforehand, to reduce the risk of MRSA. And here's the procedure. I found it really interesting. I feel a bit sorry for him, because I find some of this stuff fascinating in a horrible way. A bit bad of me, isn't it? But there we go. Hope that's helpful.